Welcome, my name is Sadaf. I'm the lead therapist and coach at Wellbeing. In today's video, I'm going to be sharing with you some tips on ways to treat depression without taking prescription drugs. Depression, some of the symptoms of which include low mood, low self-esteem, feelings of guilt, hopelessness, irritability, stress, sleeplessness and withdrawal, affects 1 adult in 6 in the UK. Globally, it's estimated that over 300 million people are affected by depression. And according to the World Health Organization, depression is a leading cause of disability and serious illness. And so therefore, it's absolutely essential to try and address depression as soon as possible. So the first line of treatment for depression is antidepressant medicines. However, there is evidence showing they may not be all that effective. Moreover, antidepressants have been promoted as a cure for depression, mostly on the basis that depression is caused due to a chemical imbalance in the brain for which there is absolutely no evidence, and there hasn't been for the last 50 years. However, oftentimes patients tend to be wary of taking antidepressants for reasons due to side effects. So, for example, it's quite common that they can cause anxiety, gastrointestinal issues, even insomnia and other symptoms. Clinicians have also highlighted that the long-term use of antidepressants may result in them not being all that effective, and they've observed that they could potentially cause a mania, hypomania, or behavioral activation. And so for these and other reasons, some people simply don't like taking prescription drugs. Fortunately, there are many alternative options for treating depression. One of the most effective ways is to get therapeutic support, in particular to transform maladaptive cognitions, emotions, and behaviors that may have arisen as a result of experiencing trauma or stressful events. In my own therapy practice, I've successfully helped clients overcome depression using a range of holistic techniques, and that includes EFT, which is a form of psychological acupuncture, somatic therapy, and EMDR and hypnotic suggestion. However, there are other evidence-based techniques, and these include cognitive behavior therapy, which is a common form of therapy that's applied to treat depression. There's Wellbeing therapy, which is very effective. And there's also Smriti meditation therapy that may help. So the remaining techniques I'm going to suggest are self-care techniques, and these you can apply in addition to therapy or without, depending on the severity of the condition. So the first technique I would say is to exercise. This is a brilliant way to manage symptoms of depression. And in fact, the evidence shows that it is as effective, if not more effective, at treating depression than antidepressant medicines. So that's definitely something you want to be trying. So a second strategy I would recommend is to engage in a problem-solving task, and this will help you to shift attention away from ruminating and improve your mood. There's various suggestions. You can play a game, play a puzzle, even cook a recipe. If you struggle to engage in a problem-solving task, then start small. Start with, say, 5 minutes, and then gradually build on that. A third strategy I would recommend is small acts of kindness. And this can also be a problem-solving task, which will shift attention away from ruminating and improve mood. A recent study that was carried out found that people who were kind to others, so for example, offered a friend a ride, cooked a meal or baked a cake for somebody, or even left a word of encouragement over 2 days for over a 5-week period experienced greater levels of life satisfaction and general well-being, and more so than those that were involved in a CBT intervention. Another form of kindness that can benefit health is self-forgiveness. Sometimes people who are depressed are very self-critical, self-condemning, almost punishing themselves. And this can happen sometimes for reasons that are totally unwarranted, where you think you've made a mistake and you haven't at all. However, other times people do genuinely make mistakes, and continuously ruminating over those can result in depressive symptoms. And in fact, evidence shows that self-forgiveness is essential for reducing symptoms of depression. And so that's another strategy that you can try practicing, which is to forgive yourself, to learn to let go of past mistakes and be more compassionate towards yourself, which will improve your mental health. So the last strategy I would recommend is challenging cognitive distortions. This is absolutely essential if you are to effectively treat depression. Negative core beliefs play a significant role in causing symptoms of depression. Beliefs such as, I'm not good enough, I'm useless, I'm not worthy, and so on. The sooner you can start challenging them, the better. How can you do this? Well, one of the ways is to question whether they're true. Is the belief true? Where's the objective evidence of the belief? Are there any alternative explanations? Are you only focusing on the negative experiences and discounting all positive experiences? Really trying to look for contradictory evidence. Be mindful, however, that negative core beliefs can develop in consequence of experiencing trauma. And if that trauma hasn't been processed properly or resolved, then it will make altering those beliefs quite difficult sometimes. I discuss this strategy and the other strategies in more detail in the article I recently wrote about depression treatment without meds, which you can find on my website. So there are many alternative ways you can treat depression. Generally, studies suggest that addressing trauma, general stress, and maintaining self-care techniques such as compassion, exercise, mindfulness, and a healthy, balanced diet may be most effective. I hope you found these suggestions useful. If you have any questions or queries, then feel free to get in touch. Take care.